whoever you send down, whoever's in charge, is by definition going to be tasked with sorting out the problem and firefighting the problem that's there today. But we need somebody to take an overview of the assets in the UL Hospital Group and how the needs of today can be met and the needs of the future can be met. I mean, there's been a historical underfunding of the health service in the Midwest compared to other regions going back a long time, notwithstanding the fact that UHL is consistently the most overcrowded hospital in the country. There were almost 450 acute and ICU beds announced across the country for 2022, none of which are in Limerick. Almost all of them were in Dublin, notwithstanding the fact, as I say, that the overcrowding in Limerick at this stage is at the same level as 9 of the hospitals in Dublin combined. So for whatever reason, there's a historical neglect of the health service in the Midwest that needs to be addressed at a political level. But I think at a management level, somebody needs to go in there and review the situation and look at how can Ennis and Nina be best utilised. St. John's and Limerick, there's a lot of talk now about a new elective hospital. I'm sceptical about that. New hospitals aren't ever built quickly in Ireland. They're never on budget. They're never on time. And that road that it was going to be built on is now being shelved by the government. So a sense that something is desperately needed. What exactly it is, I think people have an open mind on. But I mean, I'm in Northeast Clare. Limerick is obviously the hospital, but I know of lots of my constituents who, if they're ill, will desperately try to get to Galway, which equally suffers from overcrowding. But people have to be very, very sick before they go into UHL. Yeah. I mean, it's not a place I would like to go. It's a place I expect to have to go if I fall ill in the Midwest. Yeah. It's not a place I'd like a family member to go, but it's a place that family members have had to go. And most of my constituents are in that boat. And I don't think that in 2022 you should fear going to hospital. And people do fear going to UHL.